Good afternoon, Stuttgart military community. My name is Colonel Jason Condrey, your Garrison commander. You've heard me talk about making this installation the shelter for this community during this crisis. So today, I'm coming to you to describe the next evolution of social distancing. We've implemented mission essential alternate work schedules. People that can telework or work virtually are doing that. At this point, everyone in the community can generally tell me what the 5 symptoms are, where they need to go to get tested, and they're doing some sort of self-assessment each and every day. As you look at AFRICOM's 3Ds, distance, disinfect, deliberate decision making, those things capture exactly what we need to be doing, and there are similar guidelines from every command across the installation. The efforts that we begin to implement today, they're designed with an understanding of how this virus lives, how it works. You've heard me talk about the fact that it is an invisible adversary, but not a thinking one. It's not adapting to us. We can't necessarily see it, but it whispers to us, and if we're listening and paying attention, we'll be able to pick on that. So the measures that we're putting in place are designed with an understanding of how long it lives on a surface, how long it takes for those of us that aren't doctors to be able to sense symptoms and then decide not to come to work or go to a community space. And then it's also a function of how long it takes this virus to run its course. What we're doing, it may be too late. I feel like we've rushed to do this, and the reality is I may get a phone call tonight that says this individual is sick and we have to close down one of the services. I hope that once this schedule's in place, those closures are no longer than 5 days at a time, rather than a 14-day shutdown as we wait for staff to get well and come back to work. I normally start these kind of videos with an update on our case count. I can't do that any longer, but I'll tell you that I'll keep leadership across the community apprised on our number of cases. So you won't see numbers on Facebook, you won't see numbers on the app. I will continue to let you know that we continue to have additional cases. I will share as much information as I can. I can tell you that we continue to have additional cases, more yesterday through the night, and we're aggressively tracing all those contacts in order to minimize the spread of this virus. We have community members that are in hospitals, and we're monitoring them closely. I'll be able to share you the statistics of what's happening out in the local community in the state of Baden-Württemberg and across Germany. That'll give you an idea of where we are as we deal with COVID here in Germany. So here's what we know. We've got sustained spreading of COVID-19 within our community. And that's despite all the things that we have done, that you are doing each and every time you step outside of your home with respect to social distancing. We did some asymptomatic testing last weekend, and it revealed that the virus is likely everywhere. And there are people that have it that don't know that they have it. They're experiencing those symptoms. Some people that were tested last week still do not feel any impacts from the virus. There was quite a bit of pushback with respect to testing people that weren't feeling symptoms. And their pushback was valid. The reality is the number one lesson that came out of that asymptomatic testing is that social distancing, proper hygiene, and staying at home as much as possible is the number one defense against this virus. A negative test isn't informative. A positive test, however, is. And we did find a couple people that were asymptomatic that potentially were spreading the virus. And so we have stopped with some self-isolation, some self-quarantine, all the people that we found and those that they had contact with. That testing also helped us refine our screening. There's an additional symptom that we weren't looking for, the loss of taste, the loss of smell, that we now are looking for. It also caused us to start asking each and every day, is there somebody at home that we are testing or that has the symptoms which may cause you to self-quarantine or self-isolate or not come to work at all because you could be spreading the virus? So it was very helpful. We know the virus has about a 14-day life cycle. Still questions as to how long it sits on a surface, whether it's glass, metal, plastic, you name it. The reality is it follows a process. It has rules. It doesn't adapt. So we need to put in some additional measures that account for that. That allows us to break this virus in its cycle, in its path, in its process. I said it isn't silent. It whispers. And we've got to be paying attention to hear what those whispers are. And what I mean by whispers are the symptoms. So if you have fever, a cough, body aches, headaches, if you have lost the sense of smell or the ability to taste things, if it's just a hint of that, you need to be asking yourself, is this the virus? You also need to be looking at your family. Those people that you're with day in, day out, have close, persistent contact with. If any of those things are present in your family, then maybe you don't come to work. You don't go to the commissary, you don't go to the PX, you don't step outside of your home. That's a phone call that you have with your supervisor. We're not able to halt the missions that we have. We're not able to halt the critical services that we provide. They have to stay open. We're also not able to isolate ourselves from a city of 4.5 million people that are dealing with this same crisis. What that means is our partners outside the wire, they're going to have grocery stores that are open. Pharmacies are going to be open. The essential things are going to be open. I know they are implementing similar measures that we are, but the reality is if all else closes, this installation needs to be the shelter. With current work schedules and available staff, there's a very real risk that we'll need to close the main exchange, any one of our community commissaries or one of our mailrooms, for at least 14 days. As an example, our AFI staff is just over 50% right now. That's not necessarily because of a positive test or contact with somebody that has a positive test. We close schools, we close childcare. There are people that are homesick for other reasons. But the reality is we're just over 50%. And so when we're at that level of staffing, we need to be prepared to do things that allow us to absorb the shock of one more positive test. So that begs for deliberate action focused on staff and how we use those facilities, how you as a member of this community use those facilities. There is an additional demand on our PX and our commissaries. People aren't going to restaurants. People are choosing to stay home. You're cooking more at home, feeding your families. That's created an additional demand on all of those facilities. And I will tell you that there's not been an interruption in the supply to them. And I want to make sure that every time you step in there, the shelves are stocked and you get what you need. So let's talk about organizational and functional social discipline. Lots of big words, but minimal manning, alternate work schedules, video teleconferencing, working from home, and social distancing. Those are things we've already done. We've implemented, the first hour of shopping for our high-risk members of the community. That's already done. Here's the next evolution. So our critical service providers, the PX, our commissaries, and our post office, they're going to organize all of their high-contact workforce. I define those as the people that interact with you every time you come through the door. They're going to organize into 2 teams and provide an 8-day interval between contact with each other and contact with you. During those 8 days, they should be able to determine whether or not the whispers truly are symptoms that cause them to stay at home, to make that call to a supervisor. Mission partners, headquarters, units, agencies, organizations across the footprint. I'm asking them to assign their workforce evenly among 3 groups: red group, white group, blue group. Each group has 2 3-day windows per month. If you abide by these 3-day windows, that means there's a 13-day gap between when you go to the commissary and when you will go next. That allows the virus to have almost completely run its course. It absolutely allows you the opportunity to experience symptoms and know that you don't need to go to one of those places. And of course, during that window, any virus that was there will have expired on some sort of surface, whether it's a shopping cart or a shelf. And that's alongside the efforts that are deliberately made each and every day, and in some case every 30 minutes by our staff at these facilities. We'll create buttons on the app so that if you're a blue group, you can see when the facilities are open for you. These buttons not going to be up this afternoon, but they'll be up tomorrow, so look for them there. I'm also going to ask our mission partners to help identify volunteers, whether it's to handle mail that comes out of the back of a Deutsches Post truck or it's to handle groceries that are coming out of a delivery from the commissary. We're going to utilize what in the military we would call a be prepared mission, so that when I get that call that says, hey, a truck just came in, it's ahead of schedule, that we can get hands there and get the shelves stocked so that when the doors open again, you know that everything that you needed or wanted is up on the shelves and ready. So community members, here's what I'm asking of you. Deliberately plan to shop and get your mail every 2 weeks. I want you to shop where you live or work by group. Where possible, only one family member should go out and do the shopping, should buy the food at the food court, should go get mail. You continue to be the critical element in this. I know the potential for a single phone call that forces you into a 14-day staycation has already been part of our reality for the last 2 weeks. That has caused toilet paper and other essentials to fly off our shelves. I need the urgency that you felt related to keeping butts clean to quickly translate to all other essential items that you need, that your family needs over a 14-day period. This is what it'll look like at our critical services, and I define those as our community commissaries, our main exchange, and our community mailrooms. We're going to publish a flyer. It's going to be hung on Facebook, hung on the app, and hung at the front entrances of all these services. So for the main exchange, your community commissaries, and the mailrooms, they will be open days 2, 3, and 4 of every 5-day window. So this is a shift from the regular work week, weekend schedule that all of us are used to when it comes to how we live our lives, how we do our shopping. Right now, every day is COVID day until it isn't. And I'm looking for the day when we go back to some sort of normalcy, but this is what we're going to do until that day comes. So what that means, this starts on Monday with a closure. All of them will be closed on Monday. We're going to continue to get staffing set. We're going to get the schedules out. We want to make sure that mission partners have an opportunity to understand and give information to members of their organizations as to what group each individual and each individual family is in. So it starts on Monday with a closure. We open Tuesday, Wednesday, Thursday. Closed Friday, Saturday. Open again Sunday, Monday, Tuesday. And so that'll be the rhythm, that'll be the schedule. We'll put dates against those. We'll assign dates against groups. You'll be able to understand when I'm asking you to go shop, when I'm asking you not to go shop. So please take a look at the schedule. We will also limit carts to ensure that the occupancy guidance for our facilities is managed appropriately. Our public health docs have taken a look at our facilities, how they're laid out, and they have told us how many people are too many people in our commissaries, most specifically. Same thing with our mailrooms. So here are the number of people we want inside our commissaries. For Kelly, there will only be 35 carts available. For Panzer, 15 carts available. For Patch, 65 carts available, but I need you to help me ensure that the lines don't block that narrow hallway that leads back into the other half of the commissary. Robinson will have 50 carts. So there's 1 cart per person inside each of these facilities. And I will tell you, the cart is helpful. The cart helps you establish that social distancing while you're in the line. If there's not a cart available, I need you to wait. If you're not using a cart or need a cart, I'm curious if you're shopping with a deliberate 14-day thought process in mind. There are no baggers, so be deliberate, move quickly. There's probably someone outside waiting for your cart, waiting for you to be done. This can't keep you all from gathering around the dairy section. I'm going to need you to still implement some sort of social distancing inside. Our screeners will control access based upon the carts that come back into the store. Again, as quickly as you can, please get the carts back, and please ensure that the next person can go in as quickly as possible. This will require patience and kindness. I'm asking you not to direct any frustration to our screeners at the door and to the staff inside. I have told them to do this, and I'm already anticipating and encouraging your ICE comments. We're going to learn our way through this, and it's going to be rough as we start. Food courts will only have 50% of the restaurants available at any given time. As an example, at the Patch Food Court, you've got Subway, Burger King, Taco Bell, and Zenit. Starting on Monday, only 2 of those will be open. The next 5-day window, the other 2 will be open. I realize that may be a problem for some of you that must have a taco every day. I'm asking for your understanding. We're also going to stagger Starbucks and Dunkin' Donuts. I realize what a critical loss coffee would be to this community. Again, I appreciate your patience. I understand there are loyalties out there. You may have to make some exceptions. Our express gas stations will keep their current hours. And as I said before, we'll try and augment the shelves with some of those must-have items that you necessarily wouldn't go get a cart and go shopping for in the commissary or the PX. All commissaries will now have weekday and weekend openings. It's going to be based upon the 5-day schedule. In some cases, your community commissary will be open where it wasn't before. Check the app for that schedule and recognize that this is going to create more opportunities for you to shop. We're prepared to address emergencies and issues. Things will pop up: diapers, baby formula, over-the-counter medications, trash bags. I'm sure the list is endless. I'm asking you to continue to think about some of these things in advance. Don't let them be a surprise. Work with your neighbors, talk to your neighbors, talk with your unit leadership. You've always got the Garrison Assistance Team, whether an email or a phone call, to help address something that you didn't anticipate. We're going to be ready for that. We will find a solution. And then we will be ready to augment with volunteers and additional hands, whether it's the mailroom or restocking shelves. I have no doubt that we have plenty of people that are ready to move quickly should the call come forward. So questions that I think you'll ask: when does this go into effect? So right now we're still working through the schedules with our workforce. There are variables with unions and the Works Council and all kinds of different things. But starting tomorrow, everything will be closed. It'll be open on Tuesday, Wednesday, Thursday. Closed Friday, Saturday, open again on Sunday for 3 days. Look at the app. The schedule will be posted by group. Why wasn't there more warning? It's simple. I'm concerned that if we wait, that we don't get a chance to implement a plan that allows us to control closures. This plan, in my mind, creates the opportunity for us to only have to close these facilities for 5 days at the most. If we don't do something, then we potentially are waiting 14 days or more for our workforce to get healthy. So I know it's a whiplash type scenario for those of you in the community that are just now hearing about this. I know there was some initial information based upon hours that were posted at the Patch Commissary yesterday that gave some forewarning. I understand this is fast. It needs to be fast. Otherwise, our ability to affect this may be taken out of our hands. Is there science behind this? So these efforts were designed with an understanding of how long the virus lives on surfaces, how long it takes most people to feel symptoms based upon when they become effective, and the life of the virus. If you're not shopping for 14 days, then the virus arguably has run its full course if you were sick. Our workforce divided so that 8-day interval creates the opportunity for them to feel the impacts of the virus. For you in the community, at least 13 days. You can feel the effects of the virus. If you already had the virus and didn't know it, it's run its course. Those are the key elements from a public health and understanding of the virus that are driving how we're doing this. Why have you cut down the number of days we can access the PX commissaries and mailrooms? So let me compare 3 5-day windows to a 2-week period. In a 15-day window, your commissary or mailroom is open 9 of those days with these new hours. With the standard Monday through Friday schedule, with doors open, like in 3 of our 4 commissaries as an example, that was 10 days out of a 14-day window that you had access to a commissary. So as I look at the staffing available, the reality is we were going to have to start making some fairly sizable cuts to opening hours, opening days. This is not a significant decrease. This is not a reason to surge on the PX, on our commissaries, and get those things that you believe you may have to wait 2 weeks to get. Understand that this is just a reorganization of how we are doing work, how we are opening the doors. Question: how will this look different than what we saw today or yesterday? So I think as you walk into these stores, you'll probably see less cashiers. There'll be 1 or 2 lines open. There'll be longer lines at those cashiers. You won't be able to get help at the jewelry counter. You'll probably have to go back to customer service to get some assistance at different places in the store, perhaps even electronics. I know that our AFIs and our commissary managers are going to manage their workforce as best as they can. And there are lots of different reasons why something that's available today won't be available tomorrow. The intent is to protect ourselves from this virus, protect our ability to maintain these services. That's what they're going to be doing. I trust them to manage some of their critical skills and staff in order to do that. Here's probably going to be a big one. How will you enforce this? First of all, enforce is not the right word. There are very few individuals across this installation that work directly for me and are receptive to a direct order from me. So I'm asking leadership across the installation to assist with assigning groups. But the reality is there's no way I'll be able to equip all of our screeners at each of these installations with a list of the 28,000 members of our community, what organization they belong to, and what group they are assigned. So again, you're going to have to find a way to police yourselves and find a way to do this without the social media shaming. It's not helpful. Question: what if I don't get told what my group is? 50 organizations across the footprint, at least 11,000 members of our workforce, and of course all their family members. And many of them, though we've been discussing this, are finding out just now that I'm asking them to divide everybody into 3 into red, white, and blue groups. So there is a good chance you're not going to get a phone call today or tomorrow. In that scenario, I need you to take a good look at your family, how prepared you are, and I need you to assign yourself to a group. And I presume there will be a lot of people that aren't prepared, so my recommendation is to do a hard look and determine whether or not you need to be part of red group and going into the commissaries Tuesday, Wednesday, Thursday. Ask yourself the question, can we wait till Sunday? We need to find a way to distribute our community use of these facilities over 3 different groups. What do I do if I have an emergency? So I know emergencies are different for every family. I've asked our general managers to increase over-the-counter medications and other things that they've noticed are high-demand items during COVID days and have them available at the Express. We will deal with each of those emergencies as they pop up. I'm asking you to plan ahead, discuss with your neighbors, with the support structures that you've already developed as this problem has been on us for several weeks now, about how we're going to deal with emergencies. The fail-safe is going to be the Garrison assistance team. It's going to be that email, that phone call that says, hey, I've worked to solve this problem, but this is a problem I need your assistance with. We will find a way to fix the emergency. Question: why haven't you closed off non-essential items in the PX? Short answer is essential is different for every family. I've talked with my peers that have closed off sections of their PX based upon closures outside in the local economy, and the reality is that's created more problems than it's solved for them. I've asked people to keep themselves fit while closing the gyms. It makes sense that I keep that section of the PX open to them so they can do that. Art and reading may be the escape that a spouse or one of our children needs right now. I shouldn't be closing off the book and the art supplies section. I've asked people to be outside, take walks, go ride bikes. It makes sense that I make available bicycles and scooters. And the purchase of a huge flat screen that adds a second or maybe even a third TV in your household may be the difference between sanity and insanity. I'm supportive of that. Question: doesn't this drive our families to shop off the installation? So, first of all, I think many of our families are already shopping off the installation. 75% of you live off the installation. Your routine involves going to the local Lidl or Edeka or the pharmacy that's just down the block. So I know many of those Businesses are putting in similar social distancing and hygiene measures, but the reality is once they run out of staff, once they can't run a cashier, once they can't restock shelves, they're going to close their doors and our families simply will have to go somewhere else. These measures are in place so that our commissaries, our PXs, are that somewhere else when all the others close. So final thought, I know we've seen a lot of changes in the past 2 weeks, and as the virus affects us more and more, there may be more changes. I may not be able to give a lot of advance warning to those changes, and I apologize. I ask that you be patient with each other. Be patient with yourselves. These are new times. They're trying times. There's a lot of stress out there. Good manners, being polite, kindness, understanding, those are the things that we need to put into practice as we do these other things. I would tell you that under these conditions, being kind is more important than being right. I'm convinced that we're going to get through this together. We're resilient. We will work our way through this. We will learn our way through this. Be kind to each other. Thanks for your time. I appreciate your support as we make this installation our shelter.